Hello everybody, Yali here. I have a special guest today. Woohoo! I have Dr. Stephanie Owens from So Podiatry, and she is in the UK. So, what time is it right now?
Hi, Yali. It is 3:05 in the afternoon. So, yeah,
And
happy.
here is 8 o'clock in the morning. So we made this work. Yay for us.
Well done.
And I just wanted to talk to her and pick her brain on a couple of things for all of us that are interested in foot care and we're pedicurists. And you guys know that I've been wanting to connect with a podiatrist for a long time. So I had to go overseas to connect with somebody. So thank you for being here. So Stephanie, tell me a little bit about you. Like, what is it that you do? How did you get here? What's a podiatrist?
Yeah, well, I've been a podiatrist, I'm going to say, since 1999, and it is a little bit different over here in the UK as it is in America. In Canada, it's a little bit more like what we do because we don't call ourselves doctors. We haven't been to medical school. We did a straightforward degree in podiatry, or it was a 4-year degree. I did mine actually in Scotland. And then I did a
Oh,
master's degree in clinical podiatric biomechanics. So it's a little bit different in that we don't ordinarily do bone surgery or any of those things. With more conservative treatment, although you can go on to do surgery afterwards. As a
interesting. I didn't know that they didn't do the medical doctor. Like I just call you Dr. Owens.
yeah, I
I'm
guess
assuming, so sorry.
we're all still foot specialists. We make the definition. We haven't in the UK been to medical school, and we've got a bachelor's of science degree in podiatry. So we didn't do a pre-degree and then podiatry. We just did all the podiatry stuff. So I think that
Gotcha.
when we looked and talked to American podiatrists, the training's very, very similar. There's just the medical bit at the front end. We do medicine within ours, but we don't call ourselves doctors. So we don't get called
Mm,
up for a CPR in the airplanes, but we all go and help, obviously. So yeah, if
right.
there's a doctor in the house, we kind of look around. It's not us.
So if you
Yeah.
didn't want to do surgery, do you refer to somebody or is there
Yes.
additional
So
education that you take?
yeah, so after you can do it, so there's so many ways into podiatry now because in the UK it's a little bit more, I guess we don't have enough people coming into podiatry at undergraduate levels, so we're trying to look at things like apprenticeships now as well. So if you find maybe our healthcare system, some trusts are taking apprenticeships, or through private practice, if you have a bigger established practice, you're more likely to have capacity to take an apprentice in, and they train with you through the university programs together rather than going straight into university, because there's all the expense of debt coming out of university as well. Yeah, so that and then after you finish the degree program, you can do postgraduate education in lots of other things. So diabetes, rheumatology, sports science, biomechanics, surgery. You can do a master's in surgery and then do your pupillage into surgery that way. So that, those are general ones. There are lots and lots of different ones. So you go into teaching
So
and all
you
sorts.
can kind of branch out.
You can, yeah, and specialize down another alleyway, yeah. And a bit,
Wow.
just increase your scope of practice as well, whether it's pediatrics, you want to go into just sort of working with kids and young families, you can just do more training in that so that everybody has different levels of education. We're not all the same. We're all very
Wow.
special, aren't we, Ali?
Yes, yes. That's a huge difference. Wow. And
Yeah.
what made you get into the industry?
So when I've always been interested in doing something from a very young age. I think I was 13 or 14. I always wanted to work in healthcare, and I wanted to specialize in something that not many people knew about. And always been interested in sport and always did sport as a youngster. One of my neighbors down the road had a podiatrist come to her house, and I sort of seen what was going on. It was really interesting and thought, God, that's a good idea. That sounds like a good thing to do. And I suppose as a youngster, enjoying sport, I always wanted to go to the Olympics, and I thought I'm never going to race at the Olympics, but one way of going is if I'm a podiatrist, I could get to the Olympics and work there. Yeah, I just thought, well, there's another way I could travel. It's the thing with being a podiatrist, you can travel many different countries and work as a podiatrist. You can work part-time,
Oh,
you can work under a national health system, so be employed as well as private practice. And there's so many different alleyways and specialties within it, so it was really quite attractive to me. So yeah, I was one of the lucky ones. I've always known what I wanted to do, and I still love it, even with 25 20 oh gosh few years later. Yeah. So yeah,
It was yesterday. It was yesterday.
it was yesterday. Yeah. Yeah, it's such a rewarding I guess career. Really, you get to help people every single day, and you get to change people's lives and their quality of life. I mean, you can't get much better than that, can you, really?
It's true, true. And tell me about your practice. How long it's been for, and what do you do?
Yes,
What kind of services you provide?
I started So Podiatry in 2017, so we're just into our 6th year now. And it was just myself and just doing bits and bobs, because I've always worked a bit of private work, and ideally what I want to grow and develop is a multidisciplinary practice where we are a centre where we help people, and really women. I feel women's health is really ignored a lot. It's getting better now, but giving women in Worcestershire a place to come where they can get lots of holistic help and care, starting from the feet up, so looking at our foundations upwards. So we started now, we have general practice work. So what do we call it? Things like, your ingrown toenails and corns and calluses and stuff like that. I know you probably treat these as well. Anything down to like skin infections, to lumps and bumps and joint pain, problems when people walk, lower limb biomechanics and gait analysis. So we do some foot scan and RS scan and gait analysis, video gait analysis, steroid injections, nail surgery. So nail
Oh,
surgery
wow.
and local. And yeah, we use wonderful swift microwave therapy now for verrucas, or we do Faulkner's needling procedures. So anything to do with the foot, we'll have a good look at. And if we can't fix it, we work closely with podiatric surgeons and orthopedic surgeons in our area and physiotherapists in our area. And we also have black pair physiotherapists joined us at the latter end of last year. So they're working alongside us in the practice. And we're hoping to get a few more other disciplines coming and join us soon.
That's amazing. Wow.
Yeah.
Now, for those who don't know, what is gait analysis and biomechanics?
Oh, yeah, all these big words I just spur out. Gait analysis is looking at the way that people move, whether it's walking or running. Those are the two main ones. So it may be that somebody has a problem with their knee or their leg, or a hamstring injury, or shin pain, or it could be Achilles problems. Sometimes it's lower back and hip pain. It's kind of like they've been to everybody else. We've all seen those patients who they've got long-term back pain or hip pain. They've been to the physio and the osteopath, and they thought maybe you need to see a podiatrist to come along, and we identify and problem solve the reasons of why the movement isn't as good as it could be, and try and figure out whether it's something we can help with. So we would look at analysing the way that they move, and whether that's an exercise regime program, rehab exercises, stability and strength work, alongside or incorporating orthotic therapy, so an insole inside the shoe, or actually footwear modifications or footwear advice in that.
Awesome. When I do my classes, I tell them all the time that one of the main issues is the body misalignment. That's where all the pain comes from. So as simple as changing your footwear, make sure that you're, wearing the proper shoes and the proper inserts, customizable to them, to make sure that their body's aligned. It could fix most of the pain. But I think we can agree that the shoe industry is all about, looking pretty and not comfort. So we need to start changing that. Although there's new manufacturers that are coming up with like new and better shoes that look pretty and they are comfortable. But will you agree with that kind of statement? Like most of the body misalignment and pain is because of the shoes?
Do you know what? I sort of sit on the fence a little bit with how I go with this, because I don't like it when patients feel offended by. A lot of it is just about education. So most of the patients we see, and they talk about women's shoes, and women are very much pointed, it's the woman's fault. It's your fault you're wearing those shoes. And making them feel part of the blame is the real difficult bit. The psychology behind the blame is the shame of that. I more often work with the terms of, here are things that might work better for you. And thankfully, trainers are really trendy, and they've been trendy for the last 10, 15 years, which has really changed the kind of foot problems we've seen as well. So we do see our older adults wearing trainers, and they're not going, oh, I never wear trainers, I'm 85, I'm not wearing trainers. They're all wearing trainers, and that's the best thing they're going to wear. But it's about looking at the footwear. Is it fit for function? Is it fit for them? Is it fit for purpose? So what are you doing in that? I have this big bugbear, and you'll see it on my socials. I'm not a big fan of Skechers. But if somebody is at home and they're just pottering around at home, can I say pottering? You know, pottering is just moving around, not
Just
doing too
moving
much,
around, yeah.
pottering around at home. It's fine. You know, they're not going to come to too much harm. But if they're really unstable and their balance isn't very good, it might not be suitable for them, because people are more likely to have a fall at home. And if the shoes cause traction because they're too soft and they're gripping the floor, they're more likely to fall over. So it's kind of like, what are they doing in that footwear? And is it fit for them? And does it, you know, is the size, I do the very simple things with my patients. I get them to draw around their foot and draw around the shoe and look, you know, does it square peg round hole? Does it fit? You know, do your
Right.
toes overhang? Look at the space. Here's the problems you've got. And I do measure their feet, which is one thing that doesn't happen in the UK very much anymore, is people getting their feet measured. So when they're kids,
Yes.
kids get measured all the time until they grow and grow and grow. And then all of a sudden you get to about 15 or 16, and that's the end of measuring feet. Whereas our bodies change so much through our lifetime, doesn't it?
Yes.
And as we get older, you know, we lose fat in our feet, we lose muscle strength, our joints get a little bit stiffer because we lose elastin and collagen. And so our feet don't move in the same way, but yet our feet are all of a sudden the same size as when we were 20. I don't think so. So, you know, it's just education, everything, isn't it?
Right.
Yeah, it's just, you know, appealing to people's motivations of footwear. And I do
Right.
also say to ladies who love their footwear and want to wear, you know, the high heels or the cowboy boots or whatever, I says, you know what? Absolutely fine. You go for a night out and enjoy yourself, because what you wear and how you are is part of who you are. I don't want to take that away from you. So your orthotics and your footwear is your 80% of the time. Wear them, do the things you need to do, and the other 20% go and enjoy yourself and don't even worry about it, because they're, at the end of the day, it's just a pair of shoes, it's just a pair of orthotics, but this is your life, you know. So as long as you have a balance, you know, you're going to be okay.
Yes, that's fantastic. Yeah, when we talk about shoes, we don't try to shame people. We're just educating them. So I like that approach as well. And it's because we don't know, right? We don't know what we don't know. So here, at least here in America, in certain parts, like I grew up in an island in Puerto Rico, and everything that we were taught was sandals, flats, high heels, pointy shoes, you know, going to the club, those pointy high heels. And like we just didn't know, you know,
Yeah.
so we start seeing a lot of issues as we get older. So yeah, so I just tell them like, it's okay, you know, you can still wear your high heels, that's fine, but for your daily use, you might need to change that. So that's perfect. What is the
Cultural things, cultural differences with people
yes,
and their shoes and occupation, isn't it? Because it's part of a uniform. So sometimes the control is a wee bit out with what they're allowed to do, you know. So there's those, I guess there's so many parameters to think about, but also the identity, whether it's cultural or occupational, is really important to think about too.
that is so true. And we're not taught how to take care of our feet. Is the forgotten part of our body. Like we don't take care of them properly. We only remember we have feet when they start hurting. Is it not? Do you
So
feel
true.
like that's correct?
I think you're totally right. Isn't it right? I mean, your parents don't teach you how to do these things,
Mm-mm.
do they?
No,
It's kind
not
of,
at all.
I think about my own kids. I have some young kids, and it's kind of like I'm cutting their toenails and I'm teaching them to dry between their toes, and I'm making sure that they put their socks on properly, and I'm making sure the shoe fits. But that's only because I know what I know. But I mean, how many other parents do that? Because did their parents say that? So how do we really know when they have athlete's foot or verrucas what to do? Yeah.
Right, right. Um, do you see a lot of resistance from men getting foot care? Because I get that all the time in my practice with the clinical pedicures. Men don't want their feet touched. They don't want nothing done because they think this is only for women.
And so is it, I'm sure I'm sure we're both going to answer this in the same way, because I always think about who actually makes the appointment. And it's
Right.
usually the wife or the
It's
mom, isn't
usually
it?
the wife, yeah, or the girlfriend or the mom. It's always the
Yeah,
woman.
it is. And sometimes it is like, gosh, I've only come because it's got so painful and I couldn't manage anymore. So they've really put up with something a long time. Do you see that the same, I'm sure?
Oh yeah. Oh yeah. I mean, we're not preventative, we're reactive. So it's always when they're hurting, when they cannot, tolerate it anymore, then it's like, okay, fine, I'll go and see her. And the fear
Yeah.
is always, I don't want people touching my feet. I don't want them to see them because there's so much shame of it. Or this is just a woman's service and a man does not belong here. Do you get stuff like that, or is it just maybe in America?
We don't get that so much now. We don't
Okay,
get that.
good.
No. I guess
I
I guess
do.
the in the pedicurist end is making them look attractive, isn't it? And for
Right.
women, that's part of their identity. They want to feel good, they want it to look good. And men associate that just as a women's thing. Whereas I guess our aspect over here as a podiatrist, it's health. And we very much try and promote it is a health, it's a preventative service, and we want to
Right.
fix these things. But then again, we do get more towards the summertime when they're going on holiday and the men come along with fungal toenails, and they're really not attractive, are they? And
Mm-mm.
I know I see you do the flex stuff on the nails. What's that called again? The replacement,
Um,
I
the
call it
Nanoflex or
nanoflex. I
the
mean,
the toenail reconstruction product.
that's it. Yeah, I know we had this chat before about the products, and I don't really advertise that we do that, but it's men who have it. Women don't have it. And it's covering it up. So when they go on
Mm.
holiday, the once a year in their sliders or their flip-flops, you know.
Yes.
But but the vanity comes then. Yeah. Or the
Do
wife says you
you
can.
do you take that opportunity to educate them and be like, you need to be more proactive and like get this resolved instead of coming every year to get it,
Yeah.
just kind of masked?
I think men are getting a little bit better because there is so much more talk about looking after yourself and self-care
Yes.
and just as much as women. I mean, it's the younger ladies. I wouldn't say ladies in their early 20s. There's that sort of fear factor of, oh gosh, is this weird? This is a bit, have you seen this before? Apprehensive coming into the office and sitting in the waiting room. It's just not the unknown, isn't it? So once the
Right.
people are on board and have been, it's not so scary anymore. And it's like, actually, there's a stigma about feet, isn't there? And I always say,
Yes.
well, people sit in my chair every day and they go, oh, I hate my feet, they're really ugly. And it's such a shame, it's kind of like these feet do such a good job for you. My job is to try and help you appreciate and understand them. But there's no ear shaming, there's no nose shaming.
Right.
I hate my chin. I wish I didn't have my chin. It's so ugly. They're sitting here and they're really talking negatively about a part of the body that gets them out of bed, allows them to walk, go for a run and kick football, allows them to swim. You're thinking, crikey, it's just a different world, really.
Yes. Yes. I like that when you approach it like that, like appreciate your feet. Like they do so much for you and we take them for granted. They
Yeah,
carry us a lifetime.
because once they're in pain, we know what they're saying, don't we?
Right, right.
Yeah,
And yeah, it's just love your feet really because without them, where would we be, right? Like we can't do anything almost.
I
So
know.
I
And I
like that
find
that there's
my
we need
older
to like
patients,
spread that word.
yes,
Say
I
that
know
again, sorry.
I say, sorry, my older patients, they always say when your feet hurt, it shows in your face. And it so does. People feel really miserable. They just can't get
Yes,
past it. It's holding them. Everything about it is just unpleasant. And when
yes,
it goes away, they go, oh, you know. So it's lovely. It's lovely to do what we do because it fixes and makes people out of pain and they're so much better. And they appreciate that and they understand
yes.
it. But it's getting that word out there, isn't it? Self-care and looking after yourself is as well as having a chat with your mates and going for a drink and go for a walk and being mindful and everything else. It's actually, look after parts of your body, isn't it?
Yes, yes. Do you get comments like, "Oh, why you work with feet? That's weird," or like, "Why feet instead of something else?" Do you get stuff like that from friends or people?
Yeah, all the time, all the time. And I have to say, up until I ran my own practice, I used to lie when I went to parties. And I used to say, like, I stack shelves in the supermarket because then nobody'd ask you any more questions. Because inevitably, once you say you're a podiatrist, somebody gets their shoes off and you're like, oh man, I'm
Can you
just
look
wondering.
at this and tell
Yeah.
me what it is?
Oh, and everybody wants a professional opinion on the side of the street or, you know, yeah. So, but and it was more a case of I just don't want to talk about work when I'm out and I'm social and I'm having a nice
Right.
time. But I absolutely I'm delighted and I'm very proud of what I do and the life changing things I can do for people. So I don't do that anymore, and I just sort of give them my card. Off you go.
Yeah, make an appointment. I'll be
Yeah,
able to help you.
we can chat next week. Give us a call. So yeah. What sort of comments do you get?
Oh, the same. Why feet? Ew, they stink, blah, blah. And I'm like, actually, feet are the cleanest part of the body. Prove me wrong. And they're like, what? And I go, yes, you can, for a manicurist, right? Like doing nails is fun and like you can do art and all that stuff. But if you think about it, where your hands have been all day, touching things, grabbing things. And I said, feet, you just wash them, put them on a sock and inside the shoe, and that's it. Do they sweat a little bit? Sure, it's part of it. But they're cleaner. They're clean.
Yeah,
So
then
not you about feet. And they go, oh, I never thought about that. I was like, yeah.
I like that. I'm gonna use that one.
Yeah, because it's true. You wash them, you dry them, put them on a sock and keep going. And they've been
Yeah.
inside that environment all day. Your hands have been everywhere. You will not believe the things I've seen on the road. People picking noses and doing stuff.
Yeah. Yeah.
And are they smelly? Well, they've been inside a sock and they've been sweating. That's the bacteria of the odor. It's just normal. I just cleanse them and that's it. And
Yeah.
they just look at me like I'm some sort of like alien or weirdo. Like
I really
I
don't get
like feet. I don't get it.
I don't get it. Why do people not like feet? They're all different, but everybody's different, aren't they?
Exactly. That is
It's
so
different.
true.
Yeah. I don't know.
Now,
There
do
must be
you no, sorry, go ahead.
no, I was going to say I don't know where it's come from. I must be some history on it somewhere. I don't no idea
I don't
because it's
know.
just
I don't know where the shame with feet started.
uh, yeah.
It could be some cultural and generational things. Like, have you ever heard of the foot binding from, it was
Yes.
cultural in China back in centuries ago, that, if you had a smaller foot, you could
Yeah.
marry or you could be noble or whatever it was. It was
Really
horrifying.
attractive, isn't it? Yeah. Yeah.
Yeah. I think there's still one lady from China that is still alive from that generation that still has, the deformities on the foot, but
Yeah.
they stopped a
Yeah.
long time ago. And
Yeah.
so yeah, I think it could be something cultural at some point, and it just went past generations.
Yeah.
That'll be a good research.
I
I'm
know. Yeah.
gonna go
There
in
is
this rabbit hole.
a lot of psychology behind people's thoughts and yeah. But anyway, we're
Yes.
not going to fix that today, are we?
Yes. We're gonna go into this rabbit hole another
Yeah.
time.
Yeah.
What will you say is the most common issue that you see at your practice? Like, what do you do a lot?
What do we do a lot of? Plantar fasciitis, so heel pain is quite a common one. Fungal infections is a big one.
Yes.
Especially this, I mean, it's coming into spring, even though you wouldn't know it with the weather sometimes. It's coming into spring, and I'd say last week, probably 50% of people who come in had a fungal infection. And yeah, so it's managing expectations, managing people's treatment, trying to get them on board with being consistent. And it does get better. But yeah, I'd say those are probably I was in a way I separate the clinical a little bit into my general practice stuff, so stuff that you can see, and then the stuff that you can't see. So the sort of biomechanics, the gait analysis end of practice. So I see it as like two ends of it. All of general practice comes into one room, and all the other stuff goes in. So I sort of in my mind thinking, what have I seen in there, and what have I seen in there? So, yeah, heel pain would be bunions, ingrown toenails, and fungal infections. Probably the top lists, I'd say.
Yes. I agree with you. It's
Yeah.
usually the fungal infections. And then just for me, a lot of calluses, as a pedicurist, just the callus buildup is insane, but it will be secondary to the fungal infections. And here in America, they tell us that we cannot, as pedicurists, we cannot treat anybody or we cannot do a pedicure on anybody that has a fungal infection. But the problem with that is that I will say like 5 out of 6 clients have a fungal infection, whether that's just starting from a portal of entry or it's the whole nail that has been affected. And there is no other solution other than, go to a podiatrist, get the nail removed, because most of the topical things that they can find on the department stores don't work or they take forever to act.
Yeah.
Or if they take the medication, there's only one pill that they can take that is very harsh in their liver. So not everybody qualifies for that. So they're for a client, their options are very limited. So people tell me all the time, well, as a pedicurist, I can't touch that. Well, it's not up to me to diagnose if they have onychomycosis or not. They will have to go to the doctor. So I will just do a pedicure just like normal and recommend
Yeah.
products depending on what I see, right? So I don't know about that. I feel like we could do better on the fungal infection in the nail. There's so many products for athlete's foot, right? But not a lot. I mean, there is for the nail, but nothing that works as consistent as fast unless they go and get the toenail removed. Do you
Yeah.
have any products that you like that you use in your practice for onychomycosis?
No. So let me think. We approach it from the end. If they have like a little bit, it's just starting to come
Yes,
down. We just drill that all out. So we don't take the nail off straight away. We will drill all that out. So file it all out so it's disappeared, and I get them
right.
to spray the topical stuff into that.
Good.
And then as it comes up, then just hope it grows out. It depends. If it's all the whole nail, it's pretty much impossible. We will send them.
Yes.
We can't prescribe the oral terbinafine ourselves. They're a general practitioner, their GP. They will do that. But we will take samples and test it and go to them, and then they'll do that. I think this whole thing about the harsh liver bit is a wee bit blown out of proportion, because I thought it was just people in the UK talk about it, but obviously not. It was a studied one. The study on the terbinafine medication was done way back in the 70s and early 80s, I think, on a very small group of people. And the outcome of that, it caused liver damage, but they hadn't actually tested people's liver before the study. And when they went back and had a little look, those people didn't have optimum liver function to start with. So if you have optimum liver function,
Oh,
you're more likely to process the medication better. And it's a bit of an old wives' tale. So GPs are all very cautious over giving it out based on this one study back in the 70s or 80s, when I'm sure that there
interesting.
are many more studies done since, and I've seen some really great results with it. I mean, it doesn't work for everybody. Even when they take it, it doesn't mean every tone is going to grow out normal.
Right.
But it gives people options and choice, isn't it? And some people don't like the side effects of it, but it does give them options. And I think if their liver function is good and it's tested before they go onto it, and they're tested throughout it, that if it's fine, it's fine, isn't it? So I think it is that whole,
Mm-hmm.
for the baby,
I hear they
liver.
started testing before to see. So the way they say it is, we're gonna test your liver, make sure your levels are normal, and then see if you qualify for taking the pill. And then if they do, then they prescribe the pill.
Yeah.
So, but I didn't know that it was based on that.
Yeah, it's based on a really old study, and I kind of thinking, wow, that's just a bit ridiculous that ever since
Yes.
then, everybody keeps saying that, but they're not actually doing any research and reading into it. I think onychomycosis is so common, unfortunately, and it's deemed to be, oh, well, it's just aesthetic, don't worry about it, you're going to be okay. But I've noticed in patients who are more immunocompromised, they're more likely to have treatment for it. The medical system here will treat them for that because it's another infection, whereas your normal person on the street, they're just not going to bother as much. So yeah.
Yeah. Why do you think there is no more treatment for onychomycosis? Is it because of that, what you just said about people thinking that, oh, it's cosmetic?
Yeah, why is there no more treatments? Well, I think it's so difficult because when it takes over all of the nails, it's taken quite a long time. And I always say to my
Hmm.
patients, it started as athlete's foot more than likely. And athlete's foot, I say, if we think about the scale of how bad athlete's foot infection is, it can be from a 0, it's not there, to 5, you need hospitalization because you're scratching the foot of yourself. It's broken in and caused another infection. It can sit on a 1 or a 2 for years and years and years, and they don't even know they have it. So it's such a low level. And they just think they've got dry skin, and we call it moth-eaten approach. And they put moisturizer on it, which just precipitates and makes it worse, doesn't it?
Correct.
And 5, 6, 7, 8, 10 years this is going on, and all of a sudden then it's in one toenail, then it's in the next. And then the patient thinks, where did this come from? But they never looked at the sole of their feet. Or they just thought it was dry skin. And so I think that's kind of, it's just people don't, in the medical world, feet are not sexy. It's not cancer, and it's not heart disease, and it's not,
Hmm.
big treatments. So it's kind of, well, it's just your feet.
Getting
So
funding for the research could be a little tricky.
yeah, and because maybe, costs, obviously cost of that, and how important is that, on the scheme of things, I guess,
Right.
but
I guess you're right.
people come to us because it's important to them, isn't it? So they're not they're ignored by other healthcare professionals, but they come to the foot people because that's they want help for that one problem.
Yes. Oh my gosh, yes. Do you work or do you have network connections with other pedicurists that can maybe do the maintenance between appointments?
Yeah, so in the UK now there are our healthcare system is very different, obviously, than yours. So we have a national health system. Everybody knows what the NHS is, although it's very political at the moment. So there are people there who are seen by the NHS, and it has changed a lot since COVID and everything else. So they're seeing less and less people because there's more and more high risk stuff happening. So the more diabetic foot ulcers and stuff is taking up much more budgets and all of that. So people are now coming to private practices, and they may come 4 weeks, every 6 weeks, every 12 weeks, something like that. And they'll go then to a beautician and have their nails filed and nail polish and stuff, usually in between. Even more in the summertime, really, but not many. To be fair, they tend to come to us for that sort of ongoing maintenance. And I think because here we sterilize our instruments, if they go to a beauty therapist, it's not sterilized. Or nail bars who've put acrylic nails on their toenails and ripped them off. And it's just really sad stuff. And, it's really awful. So it's kind of like, when I asked, what was that place like? Well, actually, it wasn't very clean, and they just put the instrument into the little bucket of water,
disinfectant or whatever.
Soup, I call it, into the soup. And I just think, there is no guarantee that's, well, I think that's where I picked up this infection from, and or unfortunately, I've seen a few recently where they've come to me because they've got midfoot pain on one side and knee pain on the other side, and we're dealing with which well, this is really bad. And it's like, actually, I think you've got an infection. And, the little plaster on the end of the toe, they'd been to a beautician who'd cut their toe, and this deep infection had actually traveled under the foot, top of the foot, and into the back of the calf, that they then needed, they were nearly just heading for A&E for admission for IV antibiotics, that the GP gave her a massive dose. 3 weeks later, it was all sorted. But it's kind of like that, on one person, that can make a big difference. Everybody's body and system is so different. So if you cut yourself, it's okay because you know who you are and what it's like, but you don't know what the other person on the other end is.
Right. When we do our classes, we emphasize on the infection control, how important it is to keep your tools sanitized and disinfected and sterilized, really. But here in America, the state boards, they don't require sterilization. They only require disinfection. So like a high-level disinfectant. And people don't understand that if you work with somebody that had onychomycosis, fungal infection has spores, and a high-level disinfectant will not kill spores. That's only sterilization. But then at the same time, buying an autoclave or, one of those sterilizers with the heat or chemical, it could be very expensive. My autoclave was close to $2,000. So not everybody can, come up with that kind of money. And I wish they could. Maybe we can have like a program where autoclaves can be more accessible, or really it comes down to education. And that's the disconnect between the beauty industry and, in our standards. It's just that disconnect with education, because every state has their own rules. Every state has their own, schools, and not everybody teaches the same thing. And that's where all the nightmare stories come from. I mean, I hear this all the time. I got a fungal infection. I got this. I got that from another pedicure place. And it's like, man, if we can all be on the same page, that would be amazing. We need more like that,
It's just regulation, isn't it? And it's difficult to, if every state has a different regulation. I mean, that doesn't make it very easy at all, does it? Yeah. And I know what happened here when we had changes to our sterilization. I think it was about 2002. A lot of people in private practice got the patient to buy the instruments and keep them instruments, so that if they were cutting their toenails in between, they had their own toenail clippers. And then that way, then they knew they've only been used on that one person and that one person. But obviously, if they have a fungal infection, you're going to reinfect. But then, give them instructions on how to put them in a pressure cooker and how to clean them through a pressure cooker system. Or you can even do it through a microwave. The sterilizing baby bottles, you can put them into those ones for the microwave. I mean, they're relatively quite cheap to do that. And £12, I don't know, was that $20?
But it's only if it's personal use, correct?
And they're using it themselves. Yeah.
Correct. So if you're listening to this, it's only for personal use, not in your
Yeah.
pedicure place. Okay.
Yeah, yeah, and even like, other people in the same family shouldn't really be using the same ones either, because you can pick up really
Right.
nice things. I always say to patients, if you're able to do this yourself, normally they can't, but if they say, look, I just need some help and whatever, this is fine, and I'll sell them some clippers, and so be really careful and be very safe with them. Don't let anybody else use them. But this one pair is such an investment. It might be, say, £25, but that'll do you your lifetime. Do you know what I mean? How many
Yes.
times they're not going to wear out after 5 uses, are they? So it's just, yeah, good education and good technique.
Correct. And going back to the topic of onychomycosis, have you seen patients that their fungal infection is more internal, like maybe like a gut disease?
It's something I do always ask people, because sometimes it's to do with allergies as well, isn't it? The gut dysbiosis or leaky gut syndrome they talk about is an effect of an immunity, isn't it? And if people's immune systems are pretty low, they're more likely to pick these things back up again. Or
Hmm.
they've had athlete's foot or a fungal skin infection for years. And they say, well, it's never worked. It's never gone away. I treat it and it keeps coming back. And we do a fungal 360 approach, I call it. And it's kind of, treat your feet, treat your socks, treat your shoes, and everywhere where your feet are going to be. So it's kind of like, 60-degree hot wash on all of your socks, or bin them, start with whole brand new ones once you start your treatments, and bath mats, towels, bed linen. Because for the environment now, people tend to use their wash machines at 30, 40 degrees, but actually 60 to kill these things.
60.
And yeah, and then treat the skin, treat the nails, and just keep going with that. They always it's habits. Patients' habits don't change, or they don't be consistent enough, and they never get past that first couple of weeks because, oh, I forgot to do this and I forgot to do that, and it just keeps going round and round. But I
Right.
think accountability. So I always make sure I get them back after 3 weeks, because it's enough time for them to know that I'm keeping an eye on them, because we all know if
Right.
somebody's watching, we're likely to do it better. Whereas, I can give the information out, but if I just let them go, they stop doing it. They don't get the results. But when they come back and they know I'm watching, I'm going to check, I'm going to go over the information again, I'm going to test them, then it means that they're more likely to get a better result, because they're going to do the things that are needed. But in terms when it comes to sort of gut stuff, I don't go into a great deal of depth with that with patients, because I'm not qualified to be fair.
Right. Right.
And a lot of it is just sort of just understanding their overall health as well.
Right. But could you tell when it's something that you're thinking, this is more systematical, more internal than just like a fungal infection from like athlete's foot or something they picked up on a public space?
I couldn't say so. Oh, it's not something I could probably comment on. I'm not medically qualified to comment
Yeah.
on that. No.
I I don't want to say I can tell, but I feel like it's different. Like the fungal infection presents very different. Like it feels like it's coming out of the system. So it looks like the whole nail, it's just coming from the inside. And you can tell when it has been from like a port of entry. So it's very curious. I wish I can like put into words the difference, but I
I
feel
know.
like I can tell them you need to go to a doctor and get checked out because this could be right indicative of something internal. And the two times that it has happened to me and I have told them and they have heed my words, they're right. Both of them had a yeast infection in their gut, and it was just manifesting
Coming.
like that. Yeah. I had a gentleman that had oh my gosh, I can't remember the name, but it was like something in the gut where the bad bacteria was more than the good, and it was affecting his toenails and also his hair. And then I had another one, a lady that she had a yeast infection as well, and her nails were all lifted, and with
Oh,
onychomycosis, and her fingernails too. So it just affected her hair, her nails, her skin. The skin looked so dull, and the hair was super fine and thin. You can tell like there was something else. So I just
yeah.
say pay attention. When I educate, just pay attention. You will know when it's a portal of entry, and then it will look different. So just send them to the doctor because there
Yeah,
must
that's
be something else. But
it.
I always find that fascinating. Can you tell I
Yeah.
like feet?
Yeah. Yeah. Oh, yeah. How did you get into a medical pedicurist? work, Daniele?
Yeah, so actually my background is in finance and business, and I just got tired of the corporate world and I just wanted to do something that had more meaning. So it took me a long time to figure out what I wanted. And then one day I just told my husband, I just want to go to beauty school because I am also very creative and artisty and whatever. And I thought that I wanted to do like the pretty fingernails and just as a hobby, nothing, I just wanted to get the stress out. And when I started doing that, the pretty nails and all that stuff, I hated it. And I was like, oh my gosh, my career's over and hasn't even started yet, my future career and hobby. But then my teacher told me about pedicure. She's like, don't give out yet. Let's try pedicures and see if this one might be the one. And when I did my first pedicure, I remember it was an elderly gentleman and his toenails were so long and curved and I had no idea, just the basic training. So I did my very best and it just felt right. It just felt like I was doing what I was supposed to do. I don't know if you get that feeling where it's like, oh, this feels like I'm supposed to be here. And I loved it. And I love how he felt so grateful and like he was just thanking me and thanking me. And I wish I could have done more, right? Um, so yeah, that's how I started. And then I started doing more pedicures and more pedicures. And so when you go to beauty school, you need to do your practical points. So you have to do your set of manicures and your set of pedicures. Well, a lot of people don't like to do feet. And I didn't want to do the nails. So I was like, hey, I'll do your pedicures if you do my nails, my fingernails. So we started switching. And then my teacher found out and she's like, but Yali, you can't do that. You have to do your manicure points. And I'm like, but I really love it so much. So then she put me in touch with the North American School of Podology, which is the one that I educate now for, to take a certified master pedicurist, which they go into like all these issues and disorders of the nails and structural deformities and the whole thing. And man, it just opened my world. And then from there, I quit my job. I gave my 2-week notice and I was like, this is what I'm going to do. And I haven't looked back since 2018. So I'm really
Wonderful.
excited.
And you're
Yeah.
teaching it as well, which is really wonderful.
Yes. So that's what I do. And now, thank you, Jesus, that I educate and I can bring, that kind of education to other pedicurists because we need it. Again, it's something that we don't talk about. And in school, what I learned in school for pedicures is a joke. Sorry, Miss John, but
But I also think
that's just the curriculum.
yeah, well, that's it. There is only a level of what you're going to learn because there's only so much you can fit in. And after that, it's a bit like your driving test, isn't it? Yeah, you're safe to get on the road, but after that, that's when you learn, isn't it?
Yes, yes.
It's
And
just like
the more I started specializing myself more, so it wasn't just the pedicure like cosmetically. Now I had that knowledge and I kept specializing myself to be more clinical. So now that's what my practice is. It's just clinical pedicures. It's not just to cover the issue, but to address it from the root if it's within my scope of practice. But I have, work hard to build like a network of professionals that I can refer to. So that way they're just not left in limbo. Like, oh, just go and see a doctor. Okay, who? Right. So I can send them. So it has worked really well. And I wish other people can have that same passion because I'm only one and man, I'm not enough. We need more people
and
that,
creating that
want to
network
do
is
this.
so important, isn't it? That network just makes a big difference because
Yes.
you're looking after the patient better because they're being sent to somebody who is reliable and recommended, and they're not just going home and thinking, oh, I'll do that another time. They can now do that, isn't it? They get the
Yes.
proper, which is so good.
And I guess my biggest challenge has been I want to connect with podiatrists and let them know I'm here. We can work alongside, But the problem is that there's such a stigma about nail technicians being just looked at as manicurists, as nail technicians only, and they don't see the benefit of partnering with a pedicurist that can actually do that maintenance in between. Because all in all, we are the first frontliners when we're talking about feet. Like, I will send you people because I see people with a lot of issues that is without, it's outside my scope of practice. But they just reduced us to, oh, you're just a nail tech. So when I opened my shop for the first time, I sent letters to all the podiatrists in my area, and I only got a response from one.
It's a shame.
It is. It is.
But
And
don't take that as
yeah,
like a negative I just think you keep going though,
Right.
because sometimes it's just the education, because they're busy doing stuff. They'll go, oh, okay, that's fine. But it's go in and say hello and introduce yourself, and you start talking about things that you know that they know about, that you know about, then they kind of, oh, so
Yes.
it's
So
not
then
just nails, you know.
yeah, and then I've been doing that where it's like knocking doors and calling them and see if they will have the time to like meet with me. But most of them are like, oh, we have a busy schedule. Like, we don't have time for that. So I've only connected with just the one, and he's been sending me clients, which is nice. But it's like, and then I've been busy too. So it's like I don't have the time to also be knocking on their doors. And it's like, come on, man, like, let's work together, you know? But I will not give up. That's for
No,
sure.
sometimes it's just sort of, you know, it's a sending of a Christmas card with some people will remember, and it just takes time. Or, you know, pop around and say, I just thought I'd pop in because I seen your patient, wherever. But yeah, it's very busy schedules. I know myself, you know, sometimes it takes a few goes. I go, okay, so yeah, I've tagged it to reply to, or I'm going to do this, I'm going to do this, and it's just so
Yes.
busy.
So when I
Just
connected with you for the first time, I was so excited. I was like, oh my gosh, you know, and I love your social media presence. By the way,
oh,
and if everybody should follow you, I will put like your link and your social media handle. We have so much educational content. I just love it. Love it, love
well,
it.
have this thing is kind of like, we want people to look after themselves, but we don't educate them enough in the public. And I say this a lot, says, oh, but patients don't know the difference in this and the difference in that. And you say, well, but what are you doing to help them with that? So I think it's everybody's responsibility to give them information about stuff so that they can identify what it is, and then ultimately then they know you can help them with it. Because if they have no idea what it is, how do they know who's going to help them? Or
Right.
they go to over-counter
Oh, you cut up there for a second.
terrain here.
Yeah, sorry, you cut up for a second.
Am I
So
back?
yeah, you're back. Yes. Go ahead, sorry.
Oh yeah, the educational content is more about just making sure the patients know, or the public know, what things can happen feet and who can help them with those problems. Um, yeah, so I do put out information out there all the time, because it's kind of like, you know, I don't know, if you wanted to buy something for, you know, I don't know, if you want to change your hair color, right? You start looking and Googling around and you want some information about it. You have so many questions you want to ask. You're like, well, first of all, how much does it cost? Because that's what everybody wants to know. How long does it take? What does it feel like? Where can I go? What days is it open? It's all
Mhm.
those kind of things. It's kind of like, well, I've got something wrong with my toenail. What is it? Is it common? You know, how do I fix
Right.
it? Who do I need to go and see? What time? It's all that stuff that people want to find. And if you don't put it out there, then how do people know? And I know a lot of podiatrists in the UK, and some of them might be very annoyed with me saying this, is kind of they wait for our professional body to say, well, you need to educate the public more. And actually, it's our responsibility to educate the public.
Right.
We are the body, we are the church of people. And it's important for us all to come out with all of the information to help the people in our area know more about the problems that we can help them with. So everybody around the world, even though you're seeing my information, but it's kind of like, it's just, it has to be very simple terms, it has to be useful, and it has to be little bits, because, you know, there's so
Right. You
much
don't need to use all that medical jargon that they're not going to understand. Just go to in simple terms.
nice and simple terms. I mean, it works better for me too.
Yes. And right now in this world where we're so connected, I mean, I found you on Instagram and we're words apart.
Yeah.
It is important to put that information out there and to let them know we are here for you. Because we have this trend of using social media just to look perfect, just to look, you know, at the beauty of things. And if you look at my Instagram for my personal educator brand and also for the clinic, you're gonna see a lot of ugly toes and a lot of issues. And I do that intentionally because I want when people find me and they look at me, because now social media is your portfolio, right? It's your job portfolio, and they want to see your kind of work. When they go to my social media, I want them to see what I do, so that way they can identify and be like, oh, I have feet like that, or I have this issue. She knows what she's talking about. I'm going to her. But if I were to post only the perfect feet with the polished toenails and the whole stuff, they're not going to come to me because in their mind, they don't have feet like that, right? And it's they're just not gonna come. So I feel like everybody that is, you know, in this industry wants to make a difference. They need to be intentional about everything that they put out there, you know, social media, website, how, you know. So I love what you do for that reason. Like, yes,
Oh,
people can identify with you and be like, oh, this is what I have. I'm gonna book an appointment with her.
and it's just simple stuff, isn't it? I find a lot of the stuff that I do every
Yes.
day is, I call it like the common sense stuff, but I forget that it's stuff that I do every day. It's new to people's worlds, and it's just
Right.
breaking it down into, here's a 3-step thing that you need to do. Together we'll get this sorted. And sort of, right, okay, here's 1, here's 2, here's 3, right? I'll see you back, and we'll check on 1 and 2 and 3. And it's kind of like, it's not overwhelming, because, you know, it's that like, how many people I know, we have the same things as like, these must be the worst feet you've ever seen. And you're like, no way, are they the worst feet I've
Mm-mm.
ever seen? You know, and I kind of think I can still remember the worst feet I've ever seen. I couldn't tell you who they are, but I remember it. And if they walked in, I wouldn't have a clue who they were until, oh, these are the feet again. I just, you know, but it doesn't matter. You're making a difference, whatever it is for everybody. And it's all relative, you know.
Yeah.
For them, it's the worst feet they've ever seen. When you kind of thinking, if, you know, it's daft, is it? Like, we're
Isn't
judging
it
them.
funny how you couldn't remember their faces, but if you look at their feet, you go, oh, so and so. I know those feet.
Yeah.
That happened to me once. Well, it happens all the time, but it happened to me once with a client where I looked at her and I'm like, have she seen, has she been here before? It was like her second time with me.
Right.
But then when I took her shoes off and I saw her feet, I was like, oh yes, I remember this one.
That's good. But it's kind of like, because it's a nice little challenge and you've enjoyed fixing it, you know, there's such a there's a real a sense of achievement when you fix the problem for somebody, because you've done something really positive, but also their reaction is lovely as well. So we get a
Yes.
win-win, because we fixed a problem, which everybody does, whether you're an accountant or whether you're a baker or whether you're a teacher, you're fixing problems all day. But also the other bit is, you know, we're fixing problems, but the other person, or the person, the problem we're fixing responds. Whereas if you're an accountant, it's just another number, and it's a bit faceless, isn't it? Whereas like we're getting that constant feedback, so it makes it really rewarding.
I love it. I love our jobs. This is awesome.
Yeah, we love
Um, I wish you can find a pedicurist. I wish I can be there and be like, I will intern with you.
Yes, you know, that'd be so good. But you might find actually it comes along in the States as well. It's just the different way it's set up. It's different. Whereas I guess here you probably would come straight in. I mean, we have obviously podiatrists. We're a protected. These years ago, you used to call it chiropodists, podiatrists, and then now there are people set up as foot health practitioners. So they do all foot care, but it's all unregulated. So it's a little bit maybe like pedicurist type work.
Right.
But you use scalpels and
No, we're not allowed.
right. So foot health practitioners are, I guess, aren't supposed to. They're not. They do a 3-week, I think, course type thing. They set up as foot health practitioners, but they put up, the difficulty is that they put up a big list of, here's all the things that we treat and we do. And, you know, we do chiropody treatments, and they kind of think you're not allowed to say that, because
Right.
it infers that you're doing what we do. And it's just a little bit tricky. So the public are a little bit like, well, I don't know the difference. They say they do diabetic feet, and I've got diabetes. I'll go to them because it's cheaper. And you're thinking,
But the consequences of a bad
I
cut.
know. And then it's also like, you know, there's no name written there. There's no qualifications, or actually there's too many qualifications. All these letters after their name, which doesn't really mean that much, because, you know, to the public, they don't know what all these letters after the name mean. And I think the fact it's unregulated, but it's super cheap, they're going to go because it's cheap. And you're thinking, okay, and if it's just normal hygienic stuff like nail care and a bit of hard skin, it's not a problem. I think it's sometimes the practitioners don't know their limits, and others do. It's really great. So I have connected with a few of them to sort of say, you know, if you come across stuff that you're not sure about, you don't know, or it's a problem, you know, just give us a call, or give us a ring, drop us an email, whatever, and we'll happily see the patient, you know.
Yes,
So
absolutely.
to build networks to make sure patients are safe, really. I have no problem, you know, lots of people cutting toenails, you know, you don't need a degree to cut toenails, you know, lots of
Right.
that, as long as it's safe and it's well and they're doing things properly, I'm happy with that, you know. And if the patient's happy with that, that's fine, you know. It's that boundary line crossing a little bit, and the public's understanding of what foot health practitioners do and what podiatrists do is kind of, that's why I put out all the information I do, because it's kind of like,
Yes.
I'm telling you what I do. I'm not going to stop bad mouthing people who are saying they do these things, because it's up to them to do with, that's their job, isn't it? This is my job. So just focus on my game.
Right. Stay in your lane. But it is frustrating for sure to see that stuff. And I'm starting to see a trend in the nail industry where there's people from other countries coming here and teaching what's it called? Chiropody, yes. And as a nail technician and pedicurist, you're not allowed to use the scalpel. You're not allowed to cut the sidewalls of the toenail to relieve ingrown toenails. You're not even supposed to treat ingrown toenails. That is up to the podiatrist, because you can cut a person and you can create an infection and they can lose their toe and their feet. Like, I just don't understand, when people take these classes from these people that they have multiple certifications or whatever, but no medical background. They're just repeating what they learned from somebody else. It's like, it's such a huge liability for the businesses, and also it's dangerous for the public health. And like, I'm trying to, the classes that we do, advanced pedicuring, we are kind of in a gray area where I'm giving you some sort of like medical training in terms of terminology and what they are, but we're not telling you to cut toenails that way. We're not, telling you to remove calluses, remove corns. We're just giving you the information so you can educate the client and be able to refer. So we train your eyes so you know what to do and what not to do. So it's concerning. It's very concerning, especially in places that the regulations are not as high. I will not be surprised if we start seeing a lot of issues coming up, and because of that. And like, people don't realize, but at least for pedicures, it's the only beauty service that you can actually kill somebody, and they don't get that. And when I tell my students, they get scared, but I want you to be scared, because I don't want you to use a scalpel on a diabetic. You just simply don't know. And clients, I tell my students all the time, clients lie, and whether they do it intentionally or not, and you just really don't know what's going on internally. So you have to treat everybody like they are at risk for that reason, and they just go, I
can see totally these courses coming in, because I see there's a big trend on social media of, I don't even know what the tool is called. It's like a sharp chisel, and they go down the toenail. This, and it's like, oh, we've taken a toenail. I'm like, oh my Lord, don't let anybody do that. And I'm like, Craigie O'Reilly, who is doing this? But I can, you can't help but watch and thinking, wow, look at that. But you're thinking that's quite frightening at the same time.
Yes.
And this is the thing, there's more of that out there than there is of, the educational stuff. And you're thinking, okay.
Right.
Right.
So yeah, it's very scary. And I'm like, oh my gosh, you guys need to learn all this stuff. Like, stop cutting toenails that way, even if it's an ingrown toenail, like the nail has actually pierced the skin, you're not allowed to touch that. You just send them to the doctor or the urgent care, because it might be even infected. It's just people use the wrong terminology all the time. So that's why we have to educate. We just have to educate. I get people all the time saying, I have an ingrown toenail. Do you do that? And I'm like, well, let me evaluate first, and then I'll tell you. And when they come, it's not even an ingrown. It's poking because of excess accumulation, or the nail is too involuted. So it's just holding skin and debris in there. And once you clean it, the pain goes away. So it's educating between the difference between an ingrown toenail and an involuted toenail. Come on, it's not the same. Stop saying the same thing.
No, I think so. It's sore, so it feels like it's pushing in. It's ingrown. It's growing in rather than it's ingrown. I mean, it's the same. I know, yeah, it is. We need to find a different word for ingrowing. It's growing in, but it isn't.
It's growing in, right? And the other issue we're seeing with podiatrists here in America is that insurances, like health insurance, our system is not the best. They keep cutting more benefits to foot care. So now podiatrists are pretty much limited to do certain things. So they used to be able to cut toenails, be able to, deal with the calluses and stuff. And insurance keeps cutting those benefits. So unless the patient is willing to pay cash, the only thing they're doing is just removing toenails or removing, almost surgery all the time. And I have had clients come to me where they're like, I went to the podiatrist and all they told me was to go and get a pedicure. And what they needed was maybe reducing the thickness of the nail, some cleanup, and it's like, what a shame, that this is what's happening. So people that
Yeah.
don't have the resources, they're left in limbo. Like they can't come to me because they can't afford it. They can't go to the podiatrist because the insurance won't cover it. And it's just
Yeah.
sad, 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 sad.
That
So
does make it tricky. Yeah.
yeah, absolutely. So hopefully we can start seeing changes. I would like to see a change in my industry where I can create or we can be recognized as maybe like an advanced pedicuring and then work alongside with podiatrists. The same way we do estheticians, right? Like we do advanced esthetician and then they can work with dermatologists, they can work with laser and all that stuff. There's nothing like that for nail techs. And again, it's needed. So we'll see. I'll have to fight that
Because like
legislation.
in the UK, you can train your own as like associate assistant. Yeah, we have the Royal College of Podiatry, and we can do you can train your own foot care assistant into assisting, and it can be like your simple toenail stuff, scalpel debridement. It's all uncovered within our own insurance, and there's it's a program set out within the Royal College of Podiatry. You can follow this program and mentored through into it, so you have your own person doing it for you. It doesn't mean that they can go and work on their own independently. It just means they work with you. And that's where there's a lot of talk as well at the moment about the foot health practitioners, because there's so multiple, I don't know how many different avenues, and people just opening up a shop and calling themselves. I don't know whether they're trained or not trained, or when they trained, or what level of training they have.
Wow.
They want to try and regulate them. So if you have regulation, then there are minimum standards, but they want to bring them into our college. And it's a bit controversial because podiatrists are like, well, they're not the same as us. We don't them with us. We're paying money for this, and any person is walking into this. But I guess it's more about regulations. If we can keep the regulations, and we know the minimum standards for the public is there, and knowing the difference in what the scope of practice is within it. So now they're looking at creating an associate role for foot health practitioners, or podiatry assistants more so, so that they are regulated but kept within our frame of reference for scope of practice and supervision. Really, if you're supervised, keep an eye on it. So it's just about being safe, isn't it? Everything's about being safe where we can.
Right. Hopefully here we can make stronger regulations for sure, because it seems like they keep lobbying to reduce more hours and more regulations, and it's just going to become crazy. And I see a lot of.
You should write your own program and propose it to the college board.
I've thought about it.
Because if the insurance companies aren't paying the podiatrists for those things, and then they're not paying you, but they're medically needing some help with it, there may be a drop down payment for that rather than the podiatrist's fee. They'll have the assistant role fee, and that you work within the podiatry practices providing those services under that supervision, I guess, if they had it, so.
It's in my 1,000 to-do list. I have it there somewhere. But yes, I definitely have to start doing something, because hoping that it's going to change is not going to do anything. So I need to start at least spreading the word and finding the right connections to see if we can start making changes, because it's really needed.
The podiatrists will see how frustrating that is and the difficulties the patients are having, that they will shout for you as well. They'll call for you. So,
Thank you.
Get them.
I'll keep you posted on that.
I'll help you write it.
Thank you. Yeah, actually, I'll take your offer. Thanks.
Yeah.
All right. So besides practice and what you do and your profession, is there anything that you like to do when you're not working? Any hobbies? Anything quirky that you might want to share?
I love netball, actually. I don't think netball's played in America. So netball is like non-running basketball, but with no backboard either. So it's a hoop, a net with a net, and it's traditionally played.
How do you spell that? I need to look it up.
NETBALL, netball. And it's brilliant. They play it all over the UK, and actually Australia, New Zealand, South Africa, gosh, there's loads. Mawali. I think it's a Commonwealth sport. I want to say it's started in Commonwealth countries, but it's very fast moving. The 7 players, so I play that sort of once a week. And I've been going to the gym. So I go to the gym in the mornings 3 times a week. But I've got a shoulder thing that's settling. Hopefully, I'll be back there. I like growing flowers. It sounds really mad, isn't it? As I get older, I'm enjoying a bit of gardening. So I've been
Are you
spending.
becoming a plant lady?
Oh, I have multiple plants. I've got a corner behind me. I moved all my plants from the living room out to the window, and yeah. And it's funny because one of my associates popped around the other day, and she goes, "Oh my Lord, there's more plants here than there are in the clinic." I'm like, "Yes, there are." Plants make you feel good, right?
Yes.
So it's kind of like, they're a living thing, and yeah, plants are very calming, I think. Yeah, and travel. I like to travel a bit. We bought a camper van last summer, so we're organized. I've
Oh,
got 2
that's
little,
fun.
so we're
And
going to.
you take those holidays that are just like a month long or 2 months long?
I wish, no. No, so Easter's coming up and the children will be off school. So I've just got the long weekends. Unfortunately, we've got a long weekend over Easter break. And, even just getting a night or 2 away. In the UK, you can be somewhere in a couple of hours, be somewhere completely different. And it's
Yes, that's
lovely.
true.
Really good. The
That's true.
scenery is very different. You could be by the beach in maybe 2 or 3 hours. You could be in the mountains in 2 or 3 hours. So it's kind of nice.
That's nice.
But yeah, no, in the summer, I'm going to take 2 weeks off. We're going to tiki tour around in our camper van around Ireland again, because I'm from Ireland, and we're going to do that. And I'm off to Finland actually. Where am I going then? Finland in May. We're going for a week to a little cabin.
Wow.
Lake in the middle of nowhere with trees. So yeah,
And more plants.
more plants and
Nature.
water.
It's always calming to
Nature.
be in
Oh,
nature, for sure.
I think
I
so. I
crave
think so.
that.
And I think when patients come into the clinic, that's why I like to have plants, because it can be a bit anxious, and sort of like having familiar things like plants and painting. I love art, art and plants. As my clinic's filled with it, my home is filled with it. It's kind of surround myself with things that make me feel good, and if my kind of people are coming to me, then they're going to feel good too. So that's my
That's
ethos.
awesome.
Yes.
I'm so jelly. I've never been to Finland, but it's in my bucket list for sure.
Yeah. We did go. I've been once before with my husband sailing with his friend, and then we went to Lapland with the children last year. It was amazing, absolutely amazing. It was really great, really magical.
That's awesome.
Like, it's a huge country, so it's like, oh my gosh, it's much bigger than you think. Yeah, but there's not many people there, so there's loads of space, loads of peace and quiet, and that's the whole thing about holidays, isn't it?
Yes, yes, I agree. I love it. Thank you for sharing that. That's so cool. Would you have any message to any pedicurists, maybe from around the world, if they're watching, about our conversation or anything?
Just, yeah, keep talking to people, keep talking to colleagues, talk to podiatrists, tell them what you do, tell them what you offer your patients or your clients, and how you could work together, because ultimately, we all have patients who need us both, really. And maybe our patients are more medical, they're not interested in the beauty end of it, I guess, but it's kind of the maintenance stuff, if it's safe and well, may keep them going, isn't it? So and it's just like, I always think, it is about that balance in life. You have to feel good, and if sometimes that little bit more of attractive stuff that they can have,
Right.
it makes them feel good, even if it's a warm wax therapy. Do you do that sort of stuff?
In some places they do. I don't do it in my practice.
But it's kind of that holistic approach to it rather than the medical approach. I think it's nice to bring those two together, because ultimately it just makes that patient feel that little bit better and cared for and treated. It's kind of, who doesn't feel good when something nice has happened, isn't it? It's kind of, and that 2 people are looking after them means that they're getting double the support, so they perhaps make more effort to look after themselves as well. Just keep communicating and keep training, keep learning new things, because being really stagnant, you just think it's the same thing over and over again. But actually, there's a whole world of information out there. There's so much reading and learning to do. And just because, you think this is my scope of practice, but you can still learn all the background stuff behind it. So, maybe about, inflammatory joint problems, or if it's, fungal infections, or maybe it's about diabetes, or injuries or dermatology. I mean, it's just a minefield of stuff, isn't it? Footwear, you know, there's no harm in learning more stuff because it just keeps you more motivated, more, you know, you get more understanding. It puts a better reference on what you're doing relative to the situation as well. So yeah.
I love that. You're so right. Thank you so much. Could you tell me your handle one more time for social media? Is it So Podiatry?
It is at SO_podiatry. Yeah.
Okay, I knew there was a symbol somewhere. Okay.
Thank you,
Thank
Alice.
you
It's been wonderful
again.
to see you. And good have a
Same,
nice
same.
morning. I'm having my evening.
Yeah,
And
my day is just getting started. You are almost like feet up and you're good.
I have another few hours to do. Don't worry. I've got loads to do yet.
Gotcha.
Yeah, nice to talk
Alrighty.
to you. Take care.
Same,
Thanks
same,
a million.
same. Thank
Cheers.
you.